Welcome to our channel, HASHMICLINICS.
So when you watch elite athletes step up to the starting blocks at the Olympics, you expect to see the absolute pinnacle of human physical condition.
Oh, yeah, absolutely.
But a few years back, you might remember everyone suddenly staring at these perfectly round, dark purple bruises. They were all over the swimmers' backs and shoulders, and it just looked completely alien.
Right, it was a very public display of a profoundly ancient practice. And I think it really clashes with our modern aesthetic of what a medical treatment is supposed to look like.
Yeah, totally. Because in modern medicine, you're so used to invisible high-tech treatments, like you swallow a pill or you slide into an MRI machine. Everything is neat, it's hidden, and highly clinical.
Exactly. Those bruises, though, they were incredibly visible, raw, and honestly a little mysterious to most people. When you see those distinct circles, it just forces you to ask what exactly is happening to the tissue under that skin.
And that is exactly our mission for this deep dive. We are decoding hijama, which is known globally as cupping therapy.
Yeah, it's a fascinating topic.
It really is. So whether you've seen those bruises on athletes or you're just insanely curious about alternative medicine, this deep dive is designed to give you some serious aha moments about what is actually going on when a vacuum cup is applied to the human body.
And we have a really incredible source for this today.
Right. Our guide for this is a comprehensive clinical manual and personal notes compiled by Professor Dr. Rifat Hashmi. And this source is entirely unique because it bridges, traditional prophetic medicine, traditional Chinese medicine, and modern clinical research.
What's really fascinating here is that to truly understand the physical mechanics of a suction cup, you first have to completely shift your medical worldview. Like you have to look through the eyes of the ancient healers who formalized this.
How so? Because they didn't just see a bruise.
No, not at all. They weren't looking at isolated symptoms. If you went to them and said, my elbow hurts or I have a headache, they didn't just treat the elbow or the head. They looked at the human body as a deeply interconnected, dynamic system.
Okay, let's unpack this. Because before we get to the physical mechanisms, we really need to understand the historical philosophy driving it. The text notes this practice has a massive historical footprint, right? It isn't just from one culture.
Oh, far from it.
Yeah.
I mean, the manual highlights cupping therapy in the ancient Egyptian Ebers papyrus, which dates all the way back to 1550 BCE.
Wow, that is incredibly old.
Yeah, and the ancient Chinese developed it to restore the flow of qi, or vital energy, through the body. Meanwhile, Greek physicians like Hippocrates were championing it to balance the bodily humors.
The humors, that's the blood, phlegm, yellow bile, and black bile, right?
Exactly. It was all about systemic balance.
And then the text points to a major philosophical shift during the Islamic or prophetic era.
Yes, it reaches this pivotal point of integration. So the word hijama comes from the Arabic root hum, which literally translates to suck or to draw out.
Okay, that makes sense.
And Prophet Muhammad highly recommended the practice as a sunnah, which is a prophetic tradition. This recommendation basically elevated hijama from just a physical remedy to a deeply holistic one.
Right, the manual talks about a triad here.
Yeah, in this tradition, healing is viewed as a triad. You have the body, called jism, the mind, or nafs, and the spirit, or ruh.
Oh.
The belief is that you just cannot treat the physical tissue without simultaneously affecting the mental and spiritual states.
Which brings us to the core philosophy outlined in the manual, which is disease begins where flow is disturbed.
Yes, flow is everything.
So if you think about your own body circulation, it's essentially a massive, highly complex highway system. If there's a traffic jam in one specific neighborhood, what the text calls stagnation, the delivery trucks carrying your oxygen and nutrients simply can't get through.
Right. They're completely blocked.
Exactly. And worse than that, the garbage trucks responsible for waste removal get completely backed up. Over time, that local neighborhood gets toxic, the trash piles up in the streets, and eventually the entire city suffers.
That traffic jam is the whole point of the therapy. Sluggish circulation causes metabolic waste to accumulate right at the cellular level.
So the cells are just sitting in their own waste.
Basically, yeah. The tissues literally become deprived of nourishment and enter a state of dysfunction. Pain, in this context, is not the disease itself. Pain is just a signal.
Okay, so what does this all mean for how you perceive your own aches and pains? If I have a sore back, is this philosophy viewing pain as just the body's check engine light warning you about a localized traffic jam?
That is the perfect translation of the concept. The pain is guiding the therapeutic intervention. Areas that are tender, tight, or discolored, they all correspond to underlying circulatory dysfunction.
So you aren't just treating the pain directly.
No. Hijama doesn't attempt to suppress the pain signal with, like, a chemical painkiller. It physically targets the root stagnation. By creating negative pressure, the goal is to mobilize that stagnant blood and fluid. You're essentially towing the crashed cars out of the way so the body's natural healing mechanisms can finally reach the site.
Okay, so if the goal is clearing the highway, how do practitioners actually do it? Let's get into the science of the section. The manual breaks down several distinct types of cupping.
Right, there's a whole spectrum of techniques.
Yeah, there's dry cupping, which relies purely on suction. There's fire cupping, where a practitioner uses a flame inside a glass cup to, like, consume the oxygen and create a vacuum.
Which looks very dramatic, but is actually quite soothing.
I can imagine. And then there's moving or massage cupping, where they apply oil and glide the cup over the skin. But the manual spends the most time on the core of hijama, which is wet cupping, or hijama bil shart.
Yeah, and this is where things get really clinical.
Because this involves making superficial scratches on the skin to actually draw fluid out of the body, right?
Exactly. And this is where modern science is currently attempting to translate ancient wisdom into measurable physiological mechanisms. The text introduces a modern scientific theory called the Taiba mechanism.
The Taiba mechanism.
Okay, yeah, and this theory describes wet cupping as acting like an artificial kidney directly on the skin.
Wait, okay, here's where it gets really interesting. An artificial kidney. How does a plastic or glass cup act like a complex internal organ?
Well, it comes down to a physiological process called pericapillary filtration.
Pericapillary filtration, that's a mouthful.
It is, but the concept is straightforward. When the practitioner applies the vacuum cup, the negative pressure pulls upward on the skin and the underlying fascia. This pressure differential physically forces fluids out of your highly pressurized capillaries, tiny blood vessels, and into the interstitial space.
Okay, let's define the interstitial space for a second, just so everyone is on the same page. That's essentially the fluid-filled waiting room between your cells and your blood vessels, right? It's where the cells dump their trash before it gets picked up by the bloodstream.
Yes, the waiting room is a great way to picture it. So the negative pressure from the cup draws localized stagnant blood, inflammatory mediators, and metabolic waste out of the capillaries and pools it all in that waiting room just under the skin.
Oh, I see.
And then, through those superficial scratches the practitioner makes, that concentrated waste is extracted directly from the body.
The manual is very careful to contrast this with standard phlebotomy, right? Like when you go to the Red Cross to donate blood.
Oh, they are completely different processes.
Right, because phlebotomy takes healthy, fast-circulating venous blood straight from a vein. Hijama, on the other hand, specifically extracts stagnant, toxic blood, what traditional medicine calls facet dam, from the superficial capillaries.
Exactly, you're not draining a vein.
But I have to push back here on behalf of anyone listening who knows a bit of biology. I mean, the human body already has a liver. It has kidneys. It has an entire lymphatic system designed through millions of years of evolution to detoxify us.
That's a very fair point.
So why would you need to cut the skin and use a vacuum to do what your internal organs already do perfectly well?
This raises a really important question, and the source actually addresses the limitations of our internal organs directly. Our liver and kidneys are phenomenal systemic detoxifiers, right? But they operate on the macro level.
Okay, so they're cleaning the main highways.
Precisely. Now, think about modern lifestyles. We have chronic stress, highly processed foods, environmental pollution, sedentary habits. All of this creates a massive, continuous influx of toxins and inflammatory markers.
And the body just can't keep up.
Right. It can overwhelm the local microcirculation. You get localized bottlenecks in the muscle fascia or in specific capillary beds that the systemic organs simply cannot efficiently reach to flush out. So hijama acts locally to clear those specific stubborn blockages, which actually relieves the overarching burden on the liver and kidneys.
Okay, but even if I accept that the microcirculation is blocked, how does the cup know to only pull out the quote-unquote bad blood? Like, why doesn't the vacuum just suck out all the healthy oxygenated blood too?
That is all a matter of fluid dynamics and viscosity.
Oh, so it's about how thick the blood is.
Exactly. Healthy oxygenated blood flows quickly and smoothly. But stagnant blood, which is loaded with cellular waste and inflammatory proteins, is thick, sluggish, and viscous. It's essentially sludge.
Sludge, wow.
Yeah, so when you apply negative pressure to a capillary bed, the pressure differential naturally pulls the heaviest, most sluggish fluids through the permeable capillary walls first. You're effectively filtering the sludge out of the system.
Okay, so if the cup acts as a localized filter for sludge, then where you place that filter has to be the most crucial part of the entire therapy. I mean, you wouldn't just slap a cup on a random part of your arm.
Definitely not. Moving from random placement to a highly structured therapeutic strategy is what separates a basic technician from a true clinical practitioner.
And according to Dr. Hashmi's manual, placing these cups is a highly structured geographical science.
It really is. The text details how practitioners overlay two primary anatomical maps. The first is the map of the Sunnah points, which is derived directly from prophetic medicine.
What do those specific targets look like?
Well, the text highlights several major ones. There's Al-Kahil, which is considered the master point.
Where is that?
It's located right between the shoulder blades around the C7 vertebra, and it's utilized for general systemic detoxification and boosting immunity. Then there are the Atine points, located on the jugular regions on the sides of the neck.
Wait, on the jugular. Isn't that dangerous?
Well, practitioners don't place them directly over the major arteries, but in the surrounding tissue, and is highly effective for treating migraines. And there's also Yafuk, which is located right on the crown of the head.
It's fascinating that the manual integrates those ancient Sunnah points with the map of traditional Chinese medicine. TCM relies on meridians, right?
Yeah, exactly.
These are the invisible channels through which energy and blood flow. I just love the analogy of a combined transit map here. The Sunnah points are like the major international airport hubs. They handle systemic, massive flow for the whole body. The TCM meridians are the local train lines connecting all the specific neighborhoods together.
That's a brilliant way to conceptualize it. You really need to know both systems to navigate the body effectively. And the manual gives a very concrete clinical example of this integration regarding sciatica.
Oh, that's that shooting nerve pain down the leg, right?
Exactly, it's debilitating. If patient presents with sciatica, a skilled practitioner does not just put a cup on their lower back and hope for the best.
Right, there's a whole protocol.
Yeah, the text outlines a protocol where they might first use moving cupping down the urinary bladder meridian, the UB meridian, in TCM to warm the channel and move stagnant energy along the entire leg.
Okay, so they're prepping the area first.
Right. Then they perform wet cupping on very specific nerve compression points, like UB23 on the lower back and GB30 on the gluteal fold. The physical goal is to decompress the nerve root and clear the inflammatory pathway.
So you are basically merging the energetic logic of Chinese medicine with the physiological decompression of Hijama.
Yes, it's a very potent combination.
But the text goes even further into esoteric territory with something called the low shoe grid. And I really need you to explain this because at first glance, it sounds like pure magic. How does a numerical grid predict illness?
I know, it sounds a bit out there at first. The Lu Shu grid is a diagnostic tool from ancient Chinese numerology. It maps a patient's constitutional makeup, which is often derived from their birth date and energy patterns, to 5 elements.
Right. Wood, fire, earth, metal, and water.
Exactly. And each element correlates directly to specific internal organ systems. For example, the metal element relates to the lungs and the large intestine. Water relates to the kidneys.
But how does a practitioner actually use that map in a clinical setting? I mean, how is it practical?
Well, by analyzing a patient through this grid, the practitioner can identify latent constitutional weaknesses. Say your grid shows a severe imbalance in the metal element. The practitioner knows you have a constitutional tendency toward respiratory issues or skin conditions.
Oh, I see.
And the brilliant part is that they can identify this before the physical symptoms even manifest. They can place cups on the corresponding meridians to strengthen the lung channels preventatively.
So it's preemptive, predictive, alternative medicine.
Exactly.
But let's pull this back to the physical reality of the clinic. We're talking about energy meridians and predictive elements, but the manual makes it very clear. Wet cupping is essentially a minor surgical procedure. It involves deliberately cutting the skin.
Yes, and the safety protocols outlined in the text are stringent, and for incredibly good reason. This is not something to be taken lightly or done in an unsanitary environment, like in someone's living room.
Right. What are the rules?
The text mandates the use of single-use, sterile surgical blades, typically a size 11 or 15 scalpel blade. The cups themselves must be fully sterile, and everything that touches blood requires strict biohazard disposal.
Are there people who absolutely shouldn't do this?
Definitely. It explicitly lists absolute contraindications.
Yeah.
A practitioner must never perform hijama on someone with hemophilia, severe anemia, or active bleeding disorders, and they must strictly avoid the abdomen and lower back during pregnancy.
Okay, so with those modern clinical safety standards in place, the manual then introduces traditional rules of timing that feel incredibly mystical.
The timing aspect is fascinating.
Yeah. According to the Sunnah, the optimal days for hijama are the 17th, 19th, and 21st days of the lunar month. The traditional logic behind this is wild. It suggests that just as the moon's gravitational pull creates the ocean tides, it heavily influences the fluids inside the human body.
It literally ties human physiology directly to celestial cycles. The idea is that during the second half of the lunar month, the bodily fluids are in a state of high tide.
High tide inside the body. That's such an interesting image.
Right. The toxins and sluggish fluids are naturally pushed closer to the surface of the skin, making them significantly easier to extract. And practically speaking, the text also notes the procedure should be done in the morning on an empty or very light stomach.
Why empty? Just to avoid nausea.
It ensures blood circulation is stable and the body is rested. Digesting a heavy meal draws a lot of blood to the stomach, so fasting dramatically reduces the risk of a sudden drop in blood pressure or dizziness during the cupping.
Okay, I hear the philosophy, I see the anatomical maps, and I understand the lunar timing. But I have to ask the ultimate scientific skeptic's question.
I figured this was coming.
Yeah, I mean, put yourself in the patient's shoes. You're lying down in a quiet, relaxing environment. The practitioner is focused entirely on you. They're setting a deep spiritual intention. You feel the physical sensation of the suction, and you get a natural rush of endorphins from the superficial stretches.
A very intense sensory experience.
Right. So, with all of that psychological staging, how do we know the pain relief isn't just a massive, highly orchestrated placebo effect?
That is a highly debated topic in modern medicine. And honestly, any responsible researcher validates that skepticism. The placebo effect is incredibly powerful. The psychological expectation of healing certainly plays a major role in how a patient perceives their recovery after hijama.
Right. If you believe it will work, you feel better.
Exactly. However, systematic reviews and clinical trials show measurable biological phenomena occurring that simply cannot be entirely explained by placebo.
Okay, so if it isn't just the placebo effect, what is physically changing in the body that researchers can actually measure?
Well, for musculoskeletal pain, things like chronic neck pain, lower back pain, and osteoarthritis, modern research points to the gait control theory of pain.
Let me see if I understand the gait control theory. Is that like when you bang your elbow on a table and your immediate instinct is to just vigorously rub the skin around it?
Yes, perfect example.
And the rubbing sensation reaches your brain faster than the pain signal, basically locking the door so the brain doesn't process the pain as severely.
That is the exact mechanism. Your spinal cord essentially has a neurological gate, or like a bouncer. The intense physical stimulation of the suction and the minor scratching essentially overwhelms that bouncer.
So the pain can't get through to the brain.
Right. The sensory input from the cup blocks the deeper pain signals from the muscles from reaching the brain. But it goes beyond just blocking pain. Researchers have documented measurable physiological changes in the blood itself.
What kind of change?
Blood tests taken before and after hijama show increased local blood flow and vasodilation.
Vasodilation, meaning the widening of the blood vessels.
Correct. The suction stimulates the release of nitric oxide in the tissues, which physically forces the blood vessels to widen and improve circulation. Furthermore, clinical trials show a documented, measurable drop in inflammatory markers, specifically C-reactive protein, or CRP.
Oh, wow. And for those listening who haven't had a metabolic panel recently, CRP is essentially the body's internal alarm bell for inflammation, right? Like if your CRP is high, your body is actively fighting something or inflamed.
Yes, exactly. Seeing a measurable drop in CRP means the systemic inflammation in the body has decreased. These are concrete biological changes happening beyond just psychological belief.
But I do want to highlight something crucial about Dr. Hashmi's manual, just to be completely clear. It is very careful to maintain scientific impartiality.
Yes, it doesn't make wild claims.
Right. It clearly states that while there is good evidence for pain management and reducing local inflammation, there is weak or no strong evidence that hijama can reverse major internal systemic diseases.
That's a very important distinction.
Yeah, like if you have type 1 diabetes, cupping is not going to restart your pancreas. If you suffer a major stroke, cupping will not instantly rehabilitate the dead brain tissue. It is a complementary therapy, not a magical cure-all.
And the most responsible clinical position is to view hijama exactly as the author presents it, as a biologically active therapy with measurable effects on pain and microcirculation. But it requires further high-quality, large-scale randomized trials before it can be fully integrated into mainstream evidence-based hospital settings.
Absolutely. So what does this all mean for you, the listener? If we step back and look at the big picture, hijama isn't just ancient folklore. It isn't just an arbitrary bruise on an Olympic swimmer's shoulder.
No, it's so much more than that.
It's a deeply structured, holistic system of mechanical, physiological, and spiritual regulation. It views your body as an interconnected whole, mapping your symptoms back to the root causes of stagnation.
Right.
Whether you are looking to relieve a stiff neck from sitting at a desk all day, or you just want to understand the origins of integrative medicine, hijama offers a truly fascinating lens on human health and how we conceptualize healing.
It forces you to remember that healing isn't always about adding a synthetic chemical to the body. Sometimes healing is simply about removing the mechanical barriers, clearing that stagnation, so the body's innate systems can do the work they were designed to do.
I love that. And to leave you with a final thought directly from Professor Hashmi's futuristic outlook in the text, we have talked a lot today about mapping cups to ancient meridians and timing them to the lunar cycles. But the manual notes that the future of hijama might actually be personalized hijama medicine.
Yeah, this part is mind-blowing. The text suggests a future integration of advanced genetic and metabolic profiling directly with point selection.
So if you connect this to the bigger picture of where healthcare is headed, imagine a future where your DNA test or your specific metabolic panel doesn't just tell you your ancestry. It actually dictates exactly which ancient prophetic or TCM points a clinical practitioner targets to optimize your specific biology.
It's merging the absolute cutting edge of genetic science with a 3,000-year-old therapy. It's incredible.
It really is. That is definitely something to chew on the next time you look at the future of healthcare. It turns out those mysterious, perfectly round purple bruises on the Olympians aren't just a mark of ancient history. They are highly precise targets on a combined transit map of the human body, clearing the traffic jams of our modern lives.
Professor Dr. Rifat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of materia medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rifat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.